So in this module, we'll discuss about facial asymmetries. What kind of facial asymmetries you might have, what kind of solutions you could adopt to permanently or temporarily fix them so that you know exactly what to do and how can you treat this condition. So let me ask you a question. So have you ever picked up your phone? Can you see me holding my phone? Took a picture of yourself and then flipped the image. I don't know if you can see it. Just give me a second. Let me show. Yeah. And flipped the image. What you might notice is that your face is slightly asymmetrical. So, what is causing you to have an asymmetrical face? So, one of the main causes that makes you have an asymmetrical face is the iPhone or your phone lens distortions. So cause you to have facial asymmetries. Yeah, this is one of the causes. And as much as we want to blame our bones for being recessed, for being asymmetrical, some of those causes are just phone lenses. Because what you need to understand is that when an image goes through processing, you're basically trying to compress a three-dimensional space into a picture that is in two dimensions. So lens distortions is one of the causes. Let me just grab some of the assets real quick. So then your brain struggles to reconstruct the image correctly. So you might not even have those asymmetries. You might not have asymmetries at all. What is happening here is that your brain and your phone lenses are unable to be accurate when it comes to representing your face. So the next cause of those facial asymmetries are asymmetrical bones. The most common asymmetrical bones that I've seen so far is a tilted sphenoid bone, a compressed or recessed cheekbone. Let's call them compressed cheekbones. One of the other common bone asymmetries I've seen is the crossbite. The crossbite is causing you to have an asymmetrical face. This is when a part of your mandible, so the forward part of your mandible, sits unevenly on your upper jaw. This causes you to have a chin asymmetry and a mandible asymmetry. So these are the kinds of asymmetries you might have because you have asymmetrical bones. You want to fix them? Here's what you can do. Tilted sphenoid bone. What you can do to for your tilted sphenoid bone is there's not much you could do to manipulate the position of that bone naturally with your hands. What you can do is you can improve the habits that over time will, how can I say, you can change the habits that will over time shift the position of that bone. So, for example, your chewing habits influence your tilted sphenoid bone. Your swallowing habits, your breathing habits influence the position of your tilted sphenoid bone. I wouldn't recommend you to manipulate the position of your sphenoid bone with your hands. So I would never recommend you cranial sacral therapy. I feel like if you were just to fix these three, you would see significant improvements of your sphenoid bone, because I had a tilted sphenoid bone myself. And this is what I've done so far, paired with resistance training. So consistent gym. Let me just use an arrow to be clear. You can change your bone structure. Your sutures, your bones are malleable. This is one of the biggest misconceptions. Your bones are still malleable. You can still change your craniofacial bones, the position of your craniofacial bones. Then there are the compressed cheekbones. For your compressed cheekbones, you could try with zygomatic pulling. You can manipulate the position of that bone. This is something that you need to do. You need to pay a lot of attention when you're doing this, because you could cause a lot of discomfort. And if you are going through discomfort, you should stop. This is not medical advice. This is only made for educational purposes. So if you ever were to consider pulling your zygomatic bones, do it with caution and be aware of the fact that you could screw up your face. So this is something that you could do. This is more of an extreme method to fix your compressed cheekbones, and this is something that I have done. I have pulled my zygomatic bones, and I haven't and I've never experienced discomfort. But this is not medical advice, so you should how can I say, you should experiment on your own. So then there is the crossbite. For that, I would highly suggest you to consult an orthodontist or somebody who could give you customized exercises for your mandible aligning. You need to align your mandible. That's how you get rid of your crossbite. So when one eye sits higher than the other, somebody in the comments asked me, when one eye sits higher than the other, this means that you have a tilted sphenoid bone, because the bone that holds your eyes is your sphenoid bone. It is rarely your infraorbital area, your infraorbital bones. It is usually your tilted sphenoid bone. You have asymmetrical eyes because you have a tilted sphenoid bone. Let me grab it. This girl, this image that I'm showing you, this case, could you recognize the asymmetry? Try to recognize the asymmetry that image that is shown in this image. She has a crossbite. Her mandible is not aligned, is misaligned. Let me show you another picture of a facial asymmetry. Let me find something that is easier to recognize. For example, in this image, what kind of asymmetries are shown? So in this one, so not only she has facial asymmetries, but she also has weak neck flexors. But that said, she has an asymmetrical sphenoid bone, so tilted sphenoid bone right here, but she also has a crossbite. We can't say much about her cheekbones, but if we were to discuss like her cheekbone asymmetry, would say it is still caused by the sphenoid bone tilt. So here's the third reason you might have an asymmetrical face. The third reason might be asymmetrical facial muscles. Asymmetrical muscles. One of the most common muscle asymmetries people might experience is a masseter asymmetry. So one part of your masseter is more developed than the other. Masseter asymmetry. Let me find some images. For example, this patient has a masseter asymmetry. You see how her mandible is aligned, so she doesn't have a crossbite. It's just that one side of her masseter is more developed than the other. What can you do to fix that? You can, first of all, and this is a soft maxing method, you can chew on the other side of your face. So if you have one side that's stronger than the other, you could obviously chew on the weaker side. The next method that could actually help you fix your masseter, and this is more extreme, is getting a masseter Botox. A masseter Botox can reduce this part of your overdeveloped masseter. Then another common asymmetry that is caused by you having asymmetrical muscles is your orbicularis oculi asymmetry. So basically, for example, these images that I've shown you represent an orbicularis oculi asymmetry. You see how it's not about the position of his eyes, but it is about the muscle that surrounds his infraorbital area. So he has wrinkles on one side. Why? Well, because this part of his orbicularis oculi is not covering the eye properly. For that, there are certain treatments you can do naturally. So, for example, orbicularis oculi training. There are lots of exercises. For example, with the soft maxing route, you would start doing orbicularis oculi training. Orbicularis oculi. We'll take a picture from Don Stark, where he explains us how to train his orbicularis oculi. What he does is he gently pulls this part of his orbicularis outward and he closes intentionally the eye. This could help you relax your orbicularis oculi and improve your. That's not bones. We've already discussed about the bones. It's when it comes to bones, it's a tilted sphenoid bone. When it comes to the muscles, it's an orbicularis oculi asymmetry. So the other thing you could consider to fix your orbicularis oculi asymmetry is there's this treatment that is called, let me just search it up. Yeah, blepharoplasty. The hard maxing route would be to get a blepharoplasty. Blepharoplasty. What this does, it basically removes parts of your muscle, of your dead skin, and it overall improves your orbicularis oculi. Excess skin, and these are permanent. So if you were to go through a blepharoplasty, and if you get botched, those results, that procedure is permanent. So I always suggest to my clients, people that are in the community, to go through the natural route. So orbicularis oculi training. The other facial asymmetry you could have that is caused by you having uneven muscles is the frontalis muscle asymmetry. Frontalis muscle asymmetry. So for your frontalis muscle, let me show you some examples of frontalis muscle asymmetry. It's basically the forehead muscle, symmetrical. It makes one eyebrow hyperactive and one eyebrow depressed. For example, this guy has a frontalis muscle asymmetry. You see how one eyebrow, one part of his frontalis muscle is hyperactive while the other is depressed. You could train your frontalis muscle just by moving your eyebrows upward and downward, or doing the UUDD method. Or if you were to consider hard maxing, what you could go through is getting Botox. Botox is a toxin that basically relaxes the frontalis muscles, the frontalis muscle. So if you have one eyebrow that is higher than the other, this means that you have a frontalis muscle asymmetry. Then there is the orbicularis oris asymmetry. So basically your mouth. For that, you could do like lip stretches. Let me show you some examples. It could be genetic. So, for example, this one is genetic. You see how the insertions of the orbicularis oris are asymmetrical. This guy has asymmetrical insertions. But most of the time, the asymmetry is developed. You develop that asymmetry. You develop your orbicularis oris asymmetry. For example, I used to beatbox a lot, and I still do. But my beatboxing has caused me to have an asymmetrical orbicularis oris. Because when I did my lip rolls and beatboxing, I used to twist my orbicularis oris in a very specific way. So one side developed more than the other. In fact, if I were to take a picture and look at my lips, I feel like I still have that orbicularis oris asymmetry. Let me show you exactly what I'm talking about. I used to do. This is a very unnatural position of your lip, of your orbicularis oris. And I can do the same on the other side. I can do the same lip roll on the other side. You see how the sound is different. Why? Well, because one part of my orbicularis oris is more developed than the other. And this has caused me to have an orbicularis oris asymmetry. For that, you need to stop doing what was causing the asymmetry, strengthen the other side. So if I do beatboxing, I need to start doing lip rolls on the other side. So I need to start doing more frequently unless I get the same exact effect. Then you need to do lip stretches. This is the soft maxing route. So orbicularis oris training. And if you were to go the hard maxing route, you just need to get orbicularis oris buttocks or fillers. You see, I have to consistently discuss with these normies that know nothing about genetics, and they always spit their genetics when genetics don't matter. This is genetic, this is not genetic. This is not genetic, and this is not genetic. Well, yeah, this could be genetic, this is not, this is definitely not genetic. This is not genetic, this is not genetic at all. This is not genetic. So these are lip stretches. Or if you were to go for the hard maxing route, you would need to get Botox or and filler too. So these are asymmetrical muscles. This is for your asymmetrical bones. Let me grab some pictures of the bones so that you know exactly what I'm talking about. Then there are compressed cheekbones. This one is fractured. I want compressed cheekbones, but I'll use this image. Then there's the crossbite. So here are the fixes. What you can do for your lens distortions. Here's what you can do to fix your lens distortions. Buy better camera. Easy fix. If I missed something, you should ask me in the comments section. Yeah, if I didn't explain something, you definitely need to say something inside of my school community, and I'll make a specific guide on that.